Hi, my name's Thomas Finch, and I'm the 5-Minute Pharmacist. I'm here to answer your pharmacy questions in 5 minutes or less. Now, a big part of my job as a pharmacist is people showing me rashes that I did not want to see in places I didn't want to think about. Today, however, you're going to get to play the pharmacist. So come on down because you're the next contestant on Does This Look Infected? Alright, our first item up for bid today is a series of red spots. Now, they're not very large, but they sure are itchy. What do you think, Doc? Does this look infected? Just click on the yes or the no buttons. You better hurry, there's 3 more people in line waiting for your advice. That's okay, if you don't want to click on the buttons, we'll just keep moving. These bumps aren't infected, but something sure is. The patient's mattress, maybe? These are bedbug bites, and you can tell because the giveaway on bedbug bites is 3 to 5 bites in a row in just a straight line or perhaps a curved pattern. Now, obviously, if the bites are large or painful or oozing, go see a doctor, but most of the time, bedbug bites can be treated with the same over-the-counter medicines that we use for any other kind of bug bite. That'd be just Benadryl or cortisone, something like that. Now, the real cure for bedbugs, though, is obviously going to be getting rid of the infestation, and that's outside of the pharmacist's job description, so we won't be talking about that here. Okay, our next item up for bid is a round red rash. It looks about the same from day to day, but it is slowly getting larger over time. It has a clear area in the center. What do you think? Does this look infected? The phone's ringing. You've got doctors on hold. They all want to talk to you. I'd say that it's a pretty safe bet that this is infected, but you might not know what it is just by the shape alone. Now, by far the most common rash in this sort of shape would be ringworm. There was actually one study done in Kansas City that showed 2 out of every 30 elementary students had ringworm of some type or another. Not always looking like this, though. Now, you know you're looking at ringworm because it's going to be raised, it's going to be itchy, it might be a little bit scaly. See, ringworm isn't caused by a worm, but by a fungi. And you can treat it with the same kind of antifungal medications that you would use to treat a fungal infection like athlete's foot. Lotrimin, clotrimazole, tinactin, or Lamisil, they all tend to work. Now, once in a while, you'll get a real stubborn ringworm that can't be treated by over-the-counter lotions. In that case, go see a doctor, but most of the times, these cut it down to size. Now, that's the common case, but here's the rare but serious one. If you have a circular rash that's not raised and it's not itchy, there's a chance it could be Lyme disease. Now, there's only 30 or 20,000 cases in the U.S. every year, and they're almost all in the northeastern United States. But if that's where you live, and if you might have been somewhere you could have been bitten by a tick, you should really get to the doctor and get checked out. Lyme disease is treatable, but the treatment is easier the sooner it's caught. Okay, and now for our last showcase of the day. Your patient is a 12-month-old with a diffuse red rash on both of her cheeks and around her mouth. She might have just a little bit on her arms and legs as well. What do you think, Doc? Does this look infected? There's lots of prescriptions waiting to be filled. You better hurry. It's baby eczema, or to be more precise, baby atopic dermatitis. It's not an infection, but an immune-mediated reaction in the skin. It doesn't happen just to babies, of course, but it's most common between 6 months and 6 years of age. Baby eczema isn't contagious, and if it's a mild case, you can go ahead and treat it at home. Something like Eucerin often does the trick to really help calm down the rash. The good news about Eucerin is that it's a European product, which means that it's not tested on animals, nor are any of the ingredients tested on animals. Now, if Eucerin isn't strong enough, or if your child's constantly itching, or it looks like there might be an infection on top of the eczema, of course, go see a pediatrician or a dermatologist. The causes of baby eczema are notoriously difficult to pin down, but one widely discussed link is to food allergies. It turns out that about half of the children with moderate to severe baby eczema actually have allergy-type antibodies to eggs in their blood. And for about half of those children, taking eggs out of the diet will cause a significant improvement in their eczema symptoms. Other foods have been suggested as links to eczema or as possible eczema triggers, but so far the only proven link is to eggs, and removing eggs from the diet seems to make a big difference for about 1 in 4 children. Thanks so much for playing Does This Look Infected? With me today. And if you had fun, I hope that you'll share it with a friend. As always, I am the 5-Minute Pharmacist, and our shows are based on the questions that you ask. So I want to encourage you to get down in the comments, get on Twitter, get on our Facebook, get on our Google Plus page, and submit your questions about pharmacy. Go ahead and subscribe, and I will see you next Wednesday, and we'll tackle them then. Oh, goodness gracious.